Good afternoon, everyone. This is Dr. Sam. Today, I'm going to move on to discuss the next mental health topic. The topic is called Generalized Anxiety Disorder. This is a very common presentation in general practice. Before I proceed, please kindly review my disclaimer. The target audience for this presentation includes anyone who is affected by the condition or their loved ones, anyone who is interested in the topic. It is also suitable for medical students as well as a general education for the general public. Before I proceed to discuss what generalized anxiety disorder is, I would like to quickly discuss what a worry is. By definition, worrying is a form of thinking about the future. It is defined as thinking about a future event or events in a way that leaves us feeling anxious or apprehensive. Okay, so it's about a future event. In our society today, there is so many stresses. It is impossible not to feel worried about something. Therefore, it is very common for almost everyone to occasionally feel worried about things in life, such as work, study, family problem, health problem, and money problem. However, if worries becomes excessive, it can lead to a condition called generalized anxiety disorder. And people with a generalized anxiety disorder find themselves extremely worried and frequently worried about all sorts of things in life. Even from a third party's point of view, there may be little or no reason to worry about. To diagnose generalized anxiety disorder, psychiatrists, psychologists, or GP usually use the DSM-5 diagnostic criteria, which is the manual uh, with which many diagnoses is being made from. And here are the criteria. Criteria number A, or number one, if the person has excessive worry and anxiety, what we call apprehensive expectation, about many events or activities in their life, such as school performance or work performance. And they occur more days than not for at least 6 months or more. As you can see here, there is time frame and frequency attached to diagnostic criteria. You worry, yes. You feel anxious, yes. To diagnose generalized anxiety, the worry and the anxiety has to be occurring more days and not and for at least 6 months. And criteria number B, individual finds that it's very hard to switch off, very difficult to control the worry. And criteria C, the anxiety and worry are associated with three or more of the following symptoms. And just like criteria A, there is frequency and duration attached to these symptoms too. They have to be present for more days than not, and has to be present for at least 6 months or more. For adult, three or more symptoms is required. For children, only one item is required. So here they are. Number one, the patient feels restless, feeling keyed up or on edge. As you can see here, it's just like standing next to the edge of a cliff of some sort. And because the person is very restless and on edge, he experiences muscle tension. You feel that the whole body is really tense. This explains why some people feel that they have got difficulty breathing because the muscles around their chest is really tense and tightened up. And they can have, shortness of breath as a symptoms associated with the muscle tension. And number three, because the person is so restless, so tense, they can also uh, manifest irritability as a symptom of anxiety. And the irritability can uh, manifest itself as an anger outburst. Some individuals. And criteria four and five is also they are also related to the first three because a person spends so much time, energy, effort, and attention worrying and feeling anxious. They've wasted so much time feeling restless on unhelpful thinking. They have less energy, okay, to focus on their work. So they feel criteria number 4, easily fatigued. And number 5, they've got difficulty concentrating on their work or being forgetful uh, more frequent than usual with their mind going blank. So this criteria number 4 and number 5 has to do with the fact that the energy is wasted, okay, on being restless, worried, anxious, wasted on muscle tension, and wasted on being irritable. So much so that they are so tired and have difficulty concentrating. So they're all related. And lastly, number 6, because of the constant worry and the inability to switch off, the worrying switch, the person have difficulty falling asleep or have difficulty staying asleep or feeling restless throughout the night with unsatisfying sleep on waking up, unrefreshed. So these are the 6 criteria for diagnosing generalized anxiety disorder, requiring 3 or more for adult and only 1 or more for children. And criteria number D is that the anxiety, worry, or physical symptoms leads to significant distress and or impairment in the patient's social, occupational, and other important areas of functioning in his or her life, such as impaired relationship with work colleagues or classmates or teachers and so on, and poor performance in school, making more mistakes than usual. And criteria number E is that the disturbance or the anxious manifestation is not caused by the physiological effect of other things such as drug of abuse, medication, or another medical condition. And finally, the disturbance is not better explained by another mental health disorder. Here they are. There are so many of them here. I'm not going to go through with you. I'm just going to show you that there are the things that psychiatrists, psychologists needs to exclude before they uh, can formally diagnose you with generalized anxiety disorder. The next point I want to discuss is how common is generalized anxiety. According to studies of the population, or what we call population study, around 4% of the people experience generalized anxiety disorder in any 12 months period. And in Australia, around 6% of Australians experience generalized anxiety disorder during their lifetime. I think this is an underestimate. I think there is a lot more people with generalized anxiety disorder, based on my experience in my work and consultations. In summary, these are the diagnostic criteria for generalized anxiety disorder: excessive anxiety and worrying, occurring more days than not for at least 6 months. And number B, unable to switch off, difficult to control the worry. C, uh, manifesting as 3 or more of the following symptoms, or 1 or more of the following symptoms in children: restlessness, muscle tension, irritability, which are really energy waster. 1, 2, and 3 energy waster. They leads to symptoms 4 and 5. Because energy is wasted, they feel easily fatigued. They have difficulty concentrating with their mind going blank. And criteria number 6 is a sleep disturbance, which obviously is associated with unable to switch off. And this worry and anxiety cause significant distress or impairment in social, occupational, or other important areas of functioning. E, the disturbance is not caused by a substance, a medication, or another medical condition. And F, the disturbance is not caused by another mental health disorder. Finally, if you or anyone you know suffers from generalized anxiety disorder, there's always help and education around. Please make sure that you contact your GP, psychologist, psychiatrist, or holistic healthcare providers. And Make sure to attend emergency department if there's an urgent crisis for assessment, diagnosis, and treatment. Thank you very much for watching my video. I'm very appreciative of your time, Chris. And these are my acknowledgement of the resources that I used to prepare this presentation. And this is the resources that I have used to access my picture. I want to acknowledge and give them credits too. Finally, thank you very much. If you like my presentation, please kindly subscribe and share. Best wishes. As usual, please stay safe and stay healthy. I will talk to you soon. Thank you very much. Take care. Bye bye.